All right, so we're going to talk about Chapter 7 then, and Chapter 7 is on the axial skeleton. Axial. A-X-I-A-L. And so it doesn't include the arms and legs or shoulders and hips. It includes the skull, the spine, and this thoracic cage. Right? The skull, the spine, and this thoracic cage. So we're going to look at, in the skull, we're going to look at cranial bones and facial bones. And then we're going to look at all the bones of the vertebrae. And then we're going to look at the ribs and the breastbone, which make up the thoracic cage. So we look at all those different bones. This is what it looks like from the front. This is what it looks like from the back. Okay? If we look at this picture, you can see all of the bones that are in that yellow color. That's the axial skeleton. So it would just be important to know as a test question what's in the axial skeleton and what's not. You can see the bone-colored ones here, the arms and the legs, the hips and the shoulders. Those are part of the appendicular skeleton, and that's what we cover in Chapter 8. Right? So there's a lot of structures, there's a lot of bones, and there's a lot of structures on those bones that you have to know. You will be able to identify all of the bones individually, like not on a skeleton, but individually. And you'll be able to identify little structures on those bones, right? So we'll start by looking at the skull. So this skull, this is going to be on your lab exam. And on the skull, we have 8 cranial bones, okay? So there's 8 cranial bones, and there are several superficial and deep facial bones. Okay, so we've got superficial and deep facial bones, and then we have cranial bones, and we're also going to identify the sutures that are in between those cranial bones. Okay, so let's look at them. These are the cranial bones. We're going to look at cranial bones first, and we're going to look at a few points on the cranial bones that you have to identify on your lab exam. So some of the cranial bones are going to be paired, meaning there's 2 of them, and some of them are going to be just singular, all right? So this is a picture of the skull from the side, and we have the parietal bones. Those are the bones that are kind of like right on the top of your head. There's a right and a left parietal bone. They're separated on the top by a suture. The frontal bone is the bone right in the front of your skull. And then the occipital bone is the bone on the back of your head, right? Then over the top of your ear canal, we have the temporal bone. So we need to know all of those. Now there's 2 other bones that aren't as visible as those cranial bones. One of them is called the sphenoid bone. And you can see it right here in purple. And it has a suture all the way around it, so it's right in your temporal area. There's only one of those, and it goes all the way across to the other temple area. Okay, so you have this one sphenoid bone going all the way through. And we're going to take a look at it inside your cranium to see some structures on it that we need to know. And then the last one that we have is this ethmoid bone. And you can see the ethmoid bone, it's this green bone here inside the eye socket, but it also goes up and down and it divides your nasal cavities. So it's inside your nose and it separates your nasal cavities. Okay. So then we have 2 parietal bones, 2 temporal bones, 1 frontal bone, 1 occipital bone, 1 sphenoid bone, 1 ethmoid bone. That gives us 8. Right? Okay. So now let's look at the sutures in between each one of these cranial bones. Erase this. so you can see them just a little better. All right, so we have in between the parietal bone and the occipital bone, there's this suture here that is called the lambdoid suture. Lambdoid suture. So that separates the parietal bone from the occipital bone. Then we have this suture that goes all the way up and around the temporal bone, dividing it from the parietal bone, and that's called the squamous suture. We have this suture right here that separates the frontal bone from the parietal bone, and that is called the coronal suture. So coronal kind of means like a crown. So it goes all the way across, like a crown. So you have to be able to identify those. And so on lab, you would identify them on a skull, and then in lecture, you would have to be able to identify them based on words. Yes, the coronal suture divides the frontal bone from the parietal bones. There's another one that's on the top of the head. And so you see it right here, and it divides the two parietal bones, divides it into a right and a left parietal bone, and that is called the sagittal suture. We know that sagittal separates a right and a left, right? Here you can see the coronal suture, that it goes all the way across, dividing the parietal bones from the frontal bone. Now let's take a look at some of the points on the cranial bones that you have to know. So here's the sphenoid bone again, right here. Okay, it's the one in purple, so you can see it on the temple area. Goes all the way across. It's not this nasal bone here, but you can see it going across at the back of the eye socket and then over to the other side. So when you're looking in the back of the eye sockets, one of the things you can see is a little hole in there that's called the optic canal, right there, optic canal. So that's one of the structures you have to know. It's a hole right inside that sphenoid bone. Okay. Then if we look at the green structure, and the green structure again is the ethmoid bone, and you can see the ethmoid bone is going all the way down through that, separating out the nasal cavity into a right and a left nasal cavity. So you've got this long piece of bone right there, and then you also have these other projections. And then you can also see it in the eye socket as well. Okay, that's all part of the ethmoid bone. So the points on the ethmoid bone that you have to know is where this division, where this divider, where it divides the right and the left nasal cavity. We call that the perpendicular plate of the ethmoid. Perpendicular plate of the ethmoid, and it divides the right and the left nasal cavity. Then we see these bumps on the side of the perpendicular plate, and those bumps are known as the middle nasal concha. Middle nasal concha. They help to slow down the air as you're breathing it in through the nose.
Can you show that one more time?
Yep, it's right here. So here and here. There's actually a superior, a middle, and an inferior nasal concha. The superior and the middle are both part of the ethmoid. The inferior one is its own facial bone. Okay. right? So then again, this is the side of the skull. So this area, this opening right here that goes into your ear canal, that's known as the external acoustic meatus. That's found in the temporal bone. That's in the temporal bone. And then right behind that opening, we have this big bump. And that's a bump that you can feel on your skull behind your ear. That's called the mastoid process. The mastoid process. So if we took the top of the skull off, if we just took a saw and sawed the whole top off and like took the cap off, that's the calvarium. Now we're looking inside the cranial cavity. So a bird's eye view down inside the cranial cavity, have taken the brain out, and we're looking inside. Now we can see this big picture of this bone here, which is the sphenoid bone. So the sphenoid bone kind of looks like a big bat, right? Looks like a big bat. And in the middle of it, there's this indentation here. It actually indents downward. That's called the sella turcica. That's where the pituitary gland sits. And so sella turcica means a Turkish saddle. So it does actually look like a saddle. It has a, like a Turkish or an English saddle. So that's part of the sphenoid bone.
And I'm sorry, what sits in there?
The pituitary gland. Yep, pituitary gland. Okay, so now we're going to look at the all of the facial bones. So there's some superficial ones, and then there's some deeper ones. Let's look at the superficial ones first. So the first one that we have is called the maxilla. The maxilla is your top jaw bone, right? And it's divided, so there's a right and a left side. We can see where there's a suture in the middle there. Then the lower jaw bone is called the mandible. So one mandible, a big, strong bone, that's your lower jaw. Then we have this purple area up here that I said was not a part of the sphenoid, and that is called your nasal bone. So there's a right and a left, there's a suture in there. And then we have the lacrimal bones. So the lacrimal bones are these bones at the back of the eye socket, this little yellow area back there. Lacrimal, whenever you hear lacrimal, you think tears. Okay, then we have some deeper facial bones. If we look inside the nasal cavity, these blue structures here, those are facial bones. They're called the inferior nasal concha. Do it in red since they're the deeper bones. Okay, inferior nasal concha, or concha, concha, however different people say it differently. We also have this blue bone up here that makes up the cheek of your bone, of your skull. That's called the zygomatic bone. Those are your cheekbones, so there's a right and a left. And then if you look inside the nasal cavity again, I told you that you have this long perpendicular plate, but that doesn't go all the way through, all the way down to divide your right and a left nasal cavity. So you have this other small facial bone in here that's called the vomer. Okay, so those aren't on your lab exam. The vomer is not on your lab exam, but I mention it because together, that perpendicular plate of the ethmoid and the vomer, they both create that bony nasal septum. So you've heard of people that have had deviated septums, right? Okay, so this is the bony nasal septum that's created by these two bones.
It's quarter after.
Okay, let me do one more thing here, and then we're going to take a break. So this is where we've taken the lower jaw off, and we're now looking up without the lower jaw on there. And so you can see the maxilla here. The maxilla makes up the majority of your hard palate on the roof of your mouth. But then right behind that is our last deep facial bone called the palatine bone. So this also makes up the hard palate. So together, the palatine bone and the maxilla, they make up that hard palate on the roof of your mouth. And there's another structure here now that we're on this picture in the occipital bone. So this yellow bone right here, this is the back of your skull. It's the occipital bone. That big hole in there, that's called the foramen magnum. So you also have to know the foramen magnum. And on either side of the foramen magnum are these two structures here, which are called the occipital condyles. And that's the only area, these two small white areas here, that's the only point where your skull sits on your vertebrae, on your spine. That's it. The rest is all held in place by muscles and tendons. Okay, so now when we look at the eye orbit, so that's like the eye socket, the bony orbit is where your eyeball sits in there. There's a lot of different bones that make up that eye orbit. So you need to know the different bones that make up the eye orbit. So we can talk about the ceiling and the floor and the sides, the lateral side, the medial side, the back. So if we look at this, we can see that the ceiling up here of the eye orbit is the frontal bone, right? And the back of the eye is the sphenoid bone. And the floor of the eye is the maxilla. And the lateral wall is the zygomatic bone. And then we have some other bones here that make up the medial wall, okay? So on the medial wall, medial is closest to the midline, we have the ethmoid bone. We have the lacrimal bone. And then we have this little yellow bone that we call the palatine bone, right? So all of those bones, 7 bones, make up the eye orbit. So you want to be able to identify those. And are they the roof, the floor, the side, lateral side, medial side? This is a picture, kind of an awkward looking picture, but it's showing that ethmoid bone as it divides the nasal cavity, so it's a lateral view of it. And so you can see here, this is the concha. So there's that middle concha. There's the superior concha, and then here's the inferior concha that's a bone, a facial bone on its own. So the superior and middle concha are part of the ethmoid bone or concha, and then the lower bone here, this inferior nasal concha, that is made up, that is a palatine, that is the inferior nasal concha. It's a bone all by itself. Okay.
So the ethmoid bone is superior, you said, and then
Yeah,
the palatine
which
is inferior?
right.
Okay.
Yep. Because the ethmoid bone has the superior nasal concha and the middle nasal concha.
Okay.
And then the inferior nasal concha is a facial bone on its own.
Okay.
Right?
Thank you.
Mm-hmm. Now, when the skull is first being formed, you know, we said that bones start to be formed inside the uterus at about 8 weeks. As these bones are being formed, they're not suturing together right away. So when the baby is born, there's more of a fibrous suture in between them. There's fibrous material in between the cranial bones. And there's a purpose for that. That's so that when that baby is coming through the spinal canal, or through the vaginal canal, you know, which isn't the inlet, it's not that wide. the baby's head those cranial bones have to kind of overlap a little bit in order to get through that birth canal. And then they come back to their normal position, and then eventually those fibrous areas are going to fuse together and create those sutures. Okay? But before they suture together, where those fibrous sutures come together, they form big fibrous areas that we call fontanelles. And fontanelles, the layman's term for those are?
Soft spot.
Soft spots. So there's a couple of soft spots that are smaller, like the mastoid fontanelle. That's in between the lambdoid suture and the squamous suture. And then there's also a sphenoidal fontanelle, and that's between the coronal suture and the squamous suture, where they come together. And the one on top of the head that we're more familiar with is this one that's called the anterior fontanelle. So it's where the sagittal suture meets the coronal suture. And it's a large fontanelle. It's a very large one. So that's the soft spot that we normally think of on the top of a baby's head. And you have to be careful. There's no bone there. So that is a fibrous material that just goes down to the meninges and then down into the cranial cavity. And that's not going to close up until that child is probably around 2 years of age. It'll completely close up. The other ones will close up within a couple of months after the baby being born. So we do have to be careful of those fontanelles. Yep.
So like, what do you have to do with breathing when it's like kind of moving?
Yeah, so you can see that, you can see it. It's more from like the blood, as the blood is going up into the brain, and it's moving that membrane up and down. So, yeah.
Is that why they tell you to watch for depression if the baby's dehydrated?
Absolutely, right. So you are looking for, if this is indented at all, right, that could be a sign of dehydration in the baby, just because they don't have enough fluid in the blood, and they don't have enough fluid in the cerebrospinal fluid, so, yep. Okay, next we're going to look at the spine, right? We're going to look at the spine. So the spine is made up of smaller bones that all stack on top of each other, and they have different characteristics in different levels of the spine. So the top level of the spine is called the cervical spine. There are 7 bones in the cervicals, 7 cervical bones. And then we get to the mid-back area, and the mid-back area is called the thoracic, and there are 12 vertebrae in the thoracic area. And then we get to the lumbar area, and the lumbar has bigger bones, but there's 5 of those. And in the sacral area, there's 1 bone, used to be 5 that fused together. And then we have the 1 coccygeal bone that used to be 4, and those 4 bones fused together to make 1 coccygeal bone or 1 coccyx. Right? So people always try to remember, how many bones in each section. One student told me once they remembered it because they eat breakfast at 7, they have lunch at noon, and they eat dinner at 5. So if that helps you at all. Now we can see when we're looking at the different spine that they have a kind of a curve to them. We're looking at the side of the spine. So this, the cervicals have a curve that looks like this. It kind of goes inward. And then the thoracics have a curve that goes more out like this. And then the lumbar goes back in again, and then the sacrum goes back out again. So we end up with these 4 spinal curves, and they're normal. That allows for less pressure on top of those bones, right? So the cervical curve here and the lumbar curve, those are both called secondary curves or acquired curves or developed developmental curves. Let's not do that. Acquired. So secondary or acquired curves. That's the cervical and the lumbar, right? The reason why they are secondary, the baby doesn't have those curves when the baby's born. They have weaker muscles. They have some muscle tone, but weaker muscles. So when the baby's laying on the crib, the first thing they learn to do is lift their head up. And that then starts to develop that cervical curve. Later on, they start to lift their arms up, and then they start to crawl, and then they start to walk, and that develops the lumbar curve. So those curves have to be developed. But the baby is born with the thoracic curve and the sacral curve. And this is because in the thoracics, you have the heart and the lungs. So you have to have enough room in this ventral cavity. And that's why the thoracic curve is there at birth. And in the sacral curve, we have other organs down there, like the reproductive organs that are developing, as well as some of the urinary organs. And so the sacral curve is that way to not impinge on those organs. Right, so you want to know the curves. They took some of the pictures out that used to be in here, but when you have an exaggerated thoracic curve, if it's exaggerated, looks more like that, looks kind of like a humpback, really, that's called a kyphosis. When you have an exaggerated thoracic curve, we call that a kyphosis. And a lot of times that develops if a person has osteoporosis as they're aging and their bone density isn't as strong. Another type of abnormal curve is when the lumbar curve becomes exaggerated. And this is called a lordosis. So we see this in like pregnant women who are carrying a lot of extra weight, so their back curves in more, or people that have a lot of abdominal fat, so they're carrying around more fat, they get more of a curve. Or we even see this in gymnasts and dancers who stretch out all the ligaments in their spine, and now they can't maintain a proper posture, and they get more of a lordotic lower spine because of that. Okay, so in between each one of the vertebrae, we have a intervertebral disc. And this is actually made up of that fibrous cartilage that we talked about in tissues. Okay, and so the disc in here, it's layered so that it really helps to cushion the two bones, so the bones aren't ever touching each other. They're not, bone to bone. And it also helps to create this space right here, which is called the intervertebral foramen. The intervertebral foramen. Foramen means opening. So in between each bone, we're going to see that opening, and that's where the spinal nerves can exit. So the spinal nerves are coming off of the spinal cord, and they can exit from those areas. Okay. This is a look at the vertebrae from a bird's eye view. So we're looking down on top of this vertebrae, and we can see the big part of the vertebrae here is called the vertebral body. Didn't go well. This right in here, this is the vertebral body. That's the biggest part of the vertebrae. And then in the back of the vertebrae, we have all these processes that are sticking out. So first we look and we see that coming off of the vertebral body are these two pedicles. So the pedicles, they're like pedestals, right? Pedestals. So that's the first thing we see coming off of the vertebral body. Then when the pedicles end, we have these two processes that stick out. Those are called the transverse processes. We see a process that sticks up in the air, and that's called the superior articular process. We see a process that points downward, and that's called the inferior articular process, and you'd actually see that better on a different picture. And then we have a process going out the back, which is called the spinous process. Right? So there's much better videos on the Science Club. If you go into the Science Club and you look these up and you're going to be looking at these vertebrae, you're going to see these pictures a little bit better. You have to be able to identify all of those for the vertebral quiz, right? So I want to make sure that you guys know where these all are. If we look at the center in between the, all of those, the vertebral body here, and we have the pedicle and the arch here, that's called the vertebral foramen. And that's where your spinal cord goes all the way down through the spine. Now, I think on your lab list you also have the arch. It's called the vertebral arch. The arch is just on the back of the vertebrae. It makes up the edges of the vertebral foramen. So you have the anterior arch right here from the vertebral body, and then you have the posterior arch here that's made up of the other parts. We've got the pedicle right here, and then from the pedicle you have these two lamina that come together to create the spinous process. So again, if you watch that other video, it's going to look and make a lot more sense, right? So I'm going to have you do that in lab today. This picture here got a little chopped off, but you can still see this is the inferior articular process. The superior articular process is up here. The transverse process is right here, and the spinous process is right here. The pedicle is right here, and the lamina is right here. So you want to just make sure you're looking at the picture, looking at the actual vertebrae, because I'm going to use an actual vertebrae to show you all the points, to quiz you on it. Each level of the spine has they all have those same points. They have the vertebral body, they have the spinous process, transverse process, pedicle, lamina, superior and inferior articular processes. They all have the same. They just look a little bit different, and they might have some special adaptations. So when we look at the cervical spine, and again, I told you that the cervical spine has 7 vertebrae, so we number them C1, C2, C3, C4, C5, C6, C7. Okay? Each one of those are going to have the same things that I just showed you in a typical vertebrae. So there's the spinous process on the back, there's the lamina. Now you get a really good look at that lamina. There's the pedicles. You can see a really good look at the pedicles. You have the transverse process. Now the interesting thing is, in that middle of that transverse process, you have an opening there called the transverse foramen. And that you didn't see. You don't see that in any other vertebrae. It's just in the level of the cervicals. That's for the vertebral artery and vein to run up, to go into your brain. So the cervicals have this little extra hole called the transverse foramen. And we see the vertebral body, the superior articular process. The inferior one you can't really see on this picture. Couple of things to note: it's the smallest of all the vertebrae. So you know that it's a cervical. You do have to identify, is this a cervical, a thoracic, or a lumbar vertebrae? You do have to identify that. Okay? Another clue is that the spinous process is forked. It's bifid, and we don't see that in any other level. Okay, then we get to the thoracic spine. Here's the thoracic spine. And again, we have all those same points. The vertebral body, the superior articular process, the inferior articular process, the transverse process, the spinous process, the pedicle, the lamina. So we have all the same points. The intervertebral foramen, all the same points. The big difference in the thoracics, first there's some smaller indentations where the ribs connect, because the ribs only connect to the thoracic spine. They don't connect to the cervicals, and they don't connect to the lumbar. But really importantly, I think, for your identification, is that the spinous process is narrow and it points straight down. It's not straight down, but it has a much steeper angle. So that's the transverse process. That's a really big clue on this is a thoracic vertebrae. Just look at that spinous process and you can see that it's pointing down much further. Then we have the lumbar vertebrae. And oh, by the way, the thoracic spine had 12 bones. So we number those T1, T2, T3, T4, all the way down to T12. The lumbar spine has 5 vertebrae, so we number them L1, L2, L3, L4, L5. When you look at the lumbar vertebrae, they are just big. They're the most massive of all the vertebrae. They have the same points. They have the vertebral body, the superior articular process, just massive. Inferior articular process, massive. Spinous process, big. Big intervertebral foramen, big pedicle, big lamina. So there's just some big structures on this bone. And that would give you a clue that that's a lumbar vertebrae. Below the lumbars, we have these 2 bones. There's one bone called the sacrum and one bone called the coccyx. The sacrum used to be 5 separate bones, but it was fused before birth. That's this bone here, and the coccyx used to be 4 bones, and then it was fused before birth. Finally, lastly, we get to the thoracic cage. The thoracic cage is the ribs and the sternum. The sternum is the breastbone here. The breastbone has 3 parts to it. It has, on the top part, the manubrium. In the middle part, the body of the sternum. And at the end, it has the xiphoid process. So this is the xiphoid process right there. At the top of the manubrium is an indentation, and that indentation is called the jugular notch. These are all pieces that you have to identify for the quiz, right? Because the vertebrae and the thoracic cage are going to be on the quiz. There are 12 pairs of ribs. There's 12 on the right and 12 on the left, right? The first 7 of those ribs are called true ribs because they attach to a cartilage that attaches directly to the sternum. The last 4 ribs are called false ribs because if they do connect to the sternum, their cartilage connects into the cartilage of the 7th rib. So we call those false. And if we look at the very last 2, ribs here, ribs 11 and 12, you can see that they don't attach at all. So they are false ribs, but we also identify those as floating ribs because they don't attach at all. And underneath those are the kidneys. All right, so it's not, you know, it's not fun having to be lectured on anatomy, but you'll have a chance to look at all of these after the exam today in lab, and then you'll have a chance to look at them again next lab.